Assalamu alaikum and welcome back to another episode of What's Up, Doc. I'm your host, Dr. Aalia Al-Barwani, and I'm a board-certified physician. My show, What's Up, Doc, is a production of Muslim Network TV, the only Muslim-focused network broadcasting in North America. You can watch all of our shows on our website at muslimnetwork.tv and on our YouTube page at youtube.com/Muslim Network TV. You can also stream our episodes and this episode and other episodes on Roku TV, Fire TV, Apple TV, and Galaxy 19. Today we have a really interesting episode, and we're going to be talking about something that affects a majority of women, but most women don't want to talk about, and that is urinary incontinence and pelvic organ prolapse, or urinary leakage is the other term for incontinence. Joining us in that discussion is Dr. Gazala Siddiqui. She's board certified in obstetrics and gynecology, OBGYN, and urogynecology, and is an associate professor at McGovern Medical School at the University of Texas Health Science Center in Houston. Dr. Siddiqui obtained her medical degree at JNM Medical College before moving on to complete her residency at Mount Sinai Hospital in Chicago. Dr. Siddiqui has also completed a fellowship in female pelvic medicine and reconstructive surgery. She's actively involved in public education and has done several talks to educate women about pelvic floor disorders. She's also involved in resident education and research. Welcome, Dr. Siddiqui.
Thank you so much for having me, Aalia. This is a very nice format, and I feel very strongly about the topics that we're going to talk today.
Exactly. I'm so happy that you're able to join us. I'm so glad that you brought up this really important topic. As I mentioned in my introduction, it's something that affects a large number of women, but a lot of people, patients and women are providers and the patients are not talking about this issue, and that causes delay in diagnosis and treatment. So I'm so happy that we have this platform here to discuss issues and topics like urinary incontinence and pelvic organ prolapse.
Yeah, so Aalia, it's very surprising that average women suffer from leakage problems anywhere from 3 to 5 years before they seek treatment for that. And surprisingly, a lot of these women have seen a primary care doctor or somebody else and taken care of their other healthcare issues like diabetes or high blood pressure, but just do not feel comfortable talking about the incontinence at all. And today, the biggest goal I have is to break the stigma and explain to women that this is something that is very common, happens as part of our aging process, and nothing to be ashamed of. There are lots of treatment options, and we can all improve the quality of life and make our life better.
I completely agree with you. I completely agree. I find that when patients do finally bring up these symptoms, I generally ask screening questions when I do my annual physical exams. I do GYN as a family physician as well. And it's seldom brought up. And then at later visits, patients will be like, oh yeah, I've had this for X number of years. And I'm like, well, we've I've been asking. This is something that I screened for, and either they just didn't feel comfortable or thought that they were too embarrassed or whatever the reason. It's not something, unfortunately, that comes up often. But when it does, I'm excited because I know that we have a lot of good ways to treat this. And so I know that just like you said, patients and women don't have to go through a poor quality of life because we can address it.
Absolutely.
So let's start with the basics. And what is urinary incontinence or urinary leakage or bladder leakage? Those are different terms for the same thing. Let's start by defining.
Sure. So urinary incontinence basically is any involuntary leakage of urine, meaning when you're not ready to go to the bathroom, you are not, planning to go to the bathroom, and all of a sudden the urine comes out. That is called leakage or incontinence. And for me, for a lot of my Muslim patients, they will say, I've not been able to maintain wudu, I do my namaz, and this is just something that's really bothersome, and it can be a big quality of life and also affects you, just don't feel as clean. And a lot of time, that's when they come in and they talk to me about it. And it could be few drops, it could be a larger amount, it could be bothersome enough that there are patients who are wearing diapers and still soaking through the diapers. So again, what I want to give hope to all the patients is that there are many, many new different treatment options, and you can definitely talk to a physician and improve your quality of life. So even if it does not go away completely, you will have very significant improvement in your symptoms. And there is no reason. And as you were saying, Aalia, a lot of times when patients don't bring it up, they have this misinformation that this is not treatable, or my aunt or my sister had it and it did not work for her, so it's not going to work for me. Just remember, everybody's different. We do not know exact reason why someone else had it or why it did not work for them. There is no reason to not seek treatment because you did not hear good results from a friend or a family member. Just remember, everybody has diabetes. Just because your aunt's diabetes is not well controlled does not mean you should not seek treatment for your diabetes. So it's something pretty simple like that.
I love that you bring up that point. And that's what I tell my patients a lot of times, because everybody's always trying to compare themselves to another family member who may have similar symptoms, maybe even a completely different diagnosis. And they just hear a few key phrases and just think, well, you couldn't find a solution, I won't be able to either. So I love that you brought up that point. The other thing that you bring up is that this can be caused by different reasons. But before we jump into it, by definition then, does this only include leakage of urine, or are there other symptoms that can come along with this?
Yes, that's a very important question. So to make it simple, we're going to talk today about two main kinds of incontinence. So one is called overactive bladder, and that is characterized by a patient waking up 3 times at night. So imagine your quality of life if you were up. There are patients who are waking up 5 to 6 times at night. So overactive bladder gives problems of going very frequently to the bathroom. There are women who are going to the bathroom every 30 minutes during the day. They may be waking up 4 to 5 times at night. They have this sensation of urgency, meaning once you know you have to go, you do not have that normal wait period where you can find a bathroom. And these are the patients who are very scared of traveling or going on long road trips, because they are always very scared, what if there is no easy access to the bathroom? I see women who have stopped flying because they do not know if they can make it to an airplane bathroom on time with the long lines. So this can be very, very life-limiting, really putting a big end to all your family trips. And on the other hand, I also hear that my family hates traveling with me to go on road trips because we stop at every Buc-ee's between here to San Antonio. So
yes.
Yeah, so those are the symptoms that we see very, very commonly.
So that's with the overactive bladder, like you said. So I mean, we can get into the other kind of urinary incontinence that we have as well, because those symptoms may be a little bit different.
Yes.
But to your point about the first type, I laugh a little bit because I feel like a lot of these medications that treat it, which we'll get to later in this episode, are very creative with their commercials.
Right.
So one that I saw was like, this woman's in a long-term relationship with the bathroom or something like that. And so they can get very creative. But for a lot of women, that is how they feel, that they are really bound to access to the restroom, which, as you said, is very limiting.
Right.
Now, jumping to the next the second type of urinary incontinence, because those symptoms are a little bit different, and I'll let you take the lead on describing that for us.
Absolutely. So the other common kind of incontinence that we see is called stress incontinence. And what that involves is a physical stress on your bladder, on your abdomen. So say you're exercising, you had a big cough all of a sudden, you sneezed. I often see patients in the flu season that when somebody has a sudden unexpected sneeze, they will leak urine. So this leakage is mainly associated with a physical stress on the bladder, which could be laughing, jumping, I hear patients always say, I cannot jump with my kids. I really had to give up certain sports. I cannot do exercises like Pilates. So any of those things which causes a physical stress on the bladder, if you leak urine when you're doing that activity or exercise, that is called stress incontinence. And the way it's treated or the reason why it happens is slightly different from overactive bladder. And we will talk a little bit more into the details of why it happens and what can we do to prevent it or to improve it.
Excellent. I love that we are on the same page and going on this along the same pace as well. So to go back to what we were talking about, there are two different kinds, two different symptoms. I tend to see more of the stress incontinence in my practice. And of course, I don't see nearly as many as you do. So talk to us a little bit about which is more common and what are the numbers you're seeing as far as like the incidence of incontinence in general. I don't think we really used any numbers to introduce this.
So I'll tell you what kind you see more would be based on your patient demographics. If you have a slightly younger population, more women who have had babies. So stress incontinence, the commonest age group that you see is once you have the pregnancies and deliveries. After that, you will see a lot of stress incontinence because the process of pregnancy and delivery weakens those pelvic floor muscles and ligaments. And any woman who has had babies will tell you there has been some time in her life where she had a big cough or laugh or sneeze and she leaked urine. So that is stress incontinence. And remember, it can start early on with your first baby, get worse with the second delivery, and after 3 or 4 kids, almost every woman will notice some amount of stress incontinence. At some point in their life, it becomes bothersome enough that that's when they seek treatment. But when you take a good history and when you're talking to these patients, they will say, yeah, I do remember it. For 20 years I've had it, but now at this point in my life, it has become such a big bother that I really need to do something about it. And the mechanism of stress incontinence is mainly because of trauma to the pelvic floor or weakness of these muscles and ligaments because of the stretching and tear during pregnancies and deliveries.
Thank you for explaining that so wonderfully. So with urge incontinence, like you mentioned, it's more to do with the musculature of the bladder causing that to be overactive. And so that's when you feel like when you need to go, there's no waiting, you really need to go right away.
Right.
And then with the second type, which is the stress incontinence, it's more that you're leaking whenever there's any kind of intentional or unintentional stress within your abdominal cavity, meaning whether you're crunching or doing some kind of other exercise, if you're coughing or sneezing and you're causing that pressure inside of your stomach to kind of go up, that pushes pressure on, as you said, the bladder and causes that. Would you agree with that synopsis?
Absolutely. Aalia, you did a very beautiful job explaining the two kinds. And I think it is very important for women to know because we will see a big number of women who have both kinds of incontinence.
Exactly. And that was my next point, the mixed kind.
Right. And that is called mixed incontinence. And for these women, majority of them will tell you that they are bothered more by one versus the other. But then we also have women who have equal amounts of leakage that they are very scared to exercise or go doing something, jumping or fun activity because they will leak. And I always hear, I cannot do bungee jumping with my kids, or I cannot do, any kind of trampoline with my kids. So those things can be a big problem for them. And they also will say, I have big concerns when we go on a road trip, or, I'm scared of flying. So both kinds, or just the quality of life. I often see women who have been up 4 times at night. I see women who are scared to go to work without a pair of change of clothes because they never know when they will have an accident. And what I do want to let you know, Aalia, is that overactive bladder can happen across all age groups. So it's not your typical old lady disease. I have taken care of patients in their 30s who have such bad overactive bladder that they have had accidents in public. Or I'll just tell you, just to share, that one of my patients was an ICU nurse. She was in her 30s and she came to see me and I'm like, what happened? What's going on? And she said, last week I had a patient who was transferred to me as an ICU nurse, and I have this sick patient, and I had to leave the patient to run to the bathroom. So this can be life-limiting, or it can be a really big problem for a lot of our patients.
Thank you for sharing that, because you bring up a really good point, which is that it's not a disease of old age. And that's another reason that I think it's so important to talk about it on this platform, is that younger women think that it either actually one of two things, either that a little leakage is normal, and so they don't think that it's an issue to bring up, or that it's something of older age, and so it's not something that can happen to them, and so this must be something else. So I love that you bring up that point, because it's important to understand that while it's common, it's not normal, and we do have things and ways to improve your quality of life, because I can only imagine that it must be affecting quality of life. And with that, Dr. Siddiqui, that'll bring us to our first break. So you're watching What's Up, Doc, and we'll be back after this short break.
A free online chat can give you the personalized tips you need to start boosting your retirement savings today.
Our fellow Americans.
Right now, the COVID-19 vaccines are available to millions of Americans.
And soon, they will be available to everyone.
The science is clear. These vaccines will protect you and those you love from this dangerous and deadly disease.
They could save your life.
So we urge you to get vaccinated when it's available to you.
That's the first step to ending the pandemic and moving our country forward. It's up to you.
They took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3. Dad! You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
We are Justice for All. Headquartered in the heart of downtown Chicago, Justice for All is a global humanitarian initiative dedicated to raising awareness for human rights concerns impacting vulnerable minority groups. Our diverse team of staff and volunteers, led by Imam Malik Mujahid, work tirelessly to help Justice for All achieve their goals. We promote policies that protect religious freedom, address the root causes of mass displacement, and recognize the plight of refugees and forced migrants. Together, we can continue to stand up for justice. Justice for all.
There are 16 million children struggling with hunger in America. That's 1 in 5 daughters, sons, neighbors, and classmates who don't know where their next meal is coming from. Yet billions of pounds of good food go to waste every year. It's time we do something about it. Feeding America is a nationwide network of food banks that helps provide meals to millions of kids and families in need. Visit feedingamerica.org to help them feed even more. Together, we can solve hunger. Together, we're feeding America.
When times get dark, we can't see the help that's all around us. Let 211 be your guiding light for help with food, healthcare, and other resources.
211, how can I help you?
Call 211 or visit 211.org. 211, get connected, get help.
Something more than a birthday is happening here. Once you can see it, you can help. The sooner you recognize the signs of autism, the sooner you can make a lifetime of difference for your child. Start by answering a few simple questions at screenforautism.org.
Assalamu alaikum and welcome back to What's Up Doc. I'm your host, Dr. Al-Barwani, and today we are joined by Dr. Gazala Siddiqui. We've been talking about urinary leakage or urinary incontinence. So, Dr. Gazala, before the break, we've been talking about what are the different kinds of urinary incontinence, what are the reasons behind the two different kinds that we have, and when you described stress incontinence, you talked about how that can be as a result of different things that can change the anatomy of our urogenital system, like pregnancy and other stresses. One of the things that I see, and obviously not as often as you do, is pelvic organ prolapse as a result or a reason for urinary incontinence amongst other symptoms. So I want to talk about that because this is another topic that's very common in women, but also very much not talked about for several reasons. Either women are just uncomfortable talking about it, or they're just embarrassed by it. There are several reasons why women may not speak about it, or maybe they think that it's just something, like we said earlier, that comes with age, and so it's something to be expected. I want us to talk a little bit about that because I think it's a really important topic as well.
Yeah. So thank you for bringing that up, Aalia. Prolapse, again, a very big taboo topic. And again, women are not sure what is prolapse or what are they feeling. And a lot of times by the time they get diagnosed with prolapse, it's quite advanced prolapse when they get referred to see a specialist. So what I do want to tell you is prolapse and incontinence is kind of a lot of very similar risk factors, pregnancies, delivery, prolonged labor, diabetes, extra weight, obesity, and our habit of chronic weight bearing. So as women, sometimes we're very, very hands-on and we love lifting heavy stuff. And it's very hard for women to realize that 4 bags of grocery at a time can add up to quite a lot. So I always tell my patients, get your steps, take 2 bags at a time, try not to carry very heavy stuff, but catch on that steps, and that improves your health. What we do want to know, and talk a little bit about is that I have brought up pregnancy and delivery so much that it is very important for women after the delivery to at least talk to their doctor and talk a little bit about Kegel exercises or ask about their pelvic floor, because that is the time when you're going for your 6 weeks checkup. That is the time when you want to strengthen your muscles, when you want to get your muscles back in shape. And Kegel exercises, which a lot of women have heard about, are the exercises that help you regain the strength of your pelvic floor muscles. There is something called biofeedback or pelvic floor therapy, which is a very nice exercise program where a therapist is working with you one-on-one to strengthen your muscles of the pelvic floor. So think about it, like you're trying to lose weight on your own versus now you get a personal trainer, and the results are so much better when you're doing it with a personal trainer. So same like that, it is good to do Kegel exercises at home on your own. I do want to tell there are lots of apps available right now. There are some programs on Amazon. There's a lot of balls and little things that you can buy that can help you. But if you can get the time, please go see a pelvic floor therapist for a few sessions, and you will see tremendous difference in the way you can do your exercises. And then that's a lifelong skill that you learn, and you can continue to do those exercises at home.
I love it. And for those who have never heard of Kegel exercises, I just want to stress it's nothing that's painful, right?
Not at all.
And absolutely. And it's something that actually helps with not just urinary incontinence, but pelvic floor prolapse. Sorry, mouthful for me, but it does help with other things as well as recovery after having a baby, as you mentioned. And it also helps to strengthen a lot of, it's part of your, if I'm not mistaken, part of your core muscles.
Absolutely.
Well. And so it can help to strengthen all of that too.
Yeah.
How do you describe, okay, go ahead, sorry.
Sure, I'm going to just walk you through that. So
yes.
think of any other muscle, like as when we are taking care of our body everywhere else and we're exercising, this is just an exercise like that. So the way it was described is that when you are sitting on the toilet to empty your bladder, try and stop the stream of bladder. So that's how it's described. But once you know what muscle you're using, you can do it anytime. You can do it while watching TV. You can do it while driving. I learned good stuff from my patients, and one of my patients taught me, and she said, I do Kegels at every red light and stop sign. And by the time I reach home, I'm done. And I'm like, what an innovative way to do it, right? It's just a one squeeze and release. That's a Kegel exercise. So I would absolutely recommend to do that. And a lot of hospitals and postpartum programs now are putting information about pelvic floor therapy. And I think that's a very important thing that women need to know, because a lot of this can be prevented. We don't want to wait for 20 years later till things are bad. If you can prevent by doing those exercises now, why not? And if you ever feel that you're not doing good Kegel exercises, next time when you see your gynecologist for anything, you ask them. And most of the gynecologists can show you and teach you in the office how to do that. And once you learn that, then you can use, any time that you have to do that. But I do want to let you know, please be innovative. You don't have to set an hour out of your day to do those exercises. This is something that you can do while you're doing your routine activity, watching TV, standing and, doing some chores. Be creative and you can get your exercises out of the way.
Great. I love it. And I also like that you described it as just like you would work out other body part.
Yeah.
Because just like with working out any body part, when you stop doing it, the effects are no longer there.
Yes.
So that's another important thing. When my patients do any kind of physical therapy, they'll do it for, whatever 6-8 weeks that they're doing it. But then a few years later, they'll be like, oh, the problem came back. Well,
yes.
Well, have you been doing your home exercises, And they think that it was just during that short duration. They're not understanding, just like you described, this is a muscle exercise.
Right.
And in order, people who have abs, they're not getting their abs and then they're sitting back.
Yeah, that is a very important point that you're bringing up, because you're absolutely correct that just like any exercise, this is an exercise that needs to be continued long-term to see the benefits. But at the same time, it is not a big time commitment, and you can definitely carve out time. But I'm so glad that you brought it up, because you're absolutely right. Patients will see the improvement, then they will stop doing it, and then they will say, hey, it didn't work. It didn't work because, we're not doing it. If you stop walking, of course, you're going to gain back the weight that you lost. So that is very important. So exercise will be the first step. After the exercises, then there are more treatment options which you can talk to a physician about. You do need to see a gynecologist. If need, you need to see a specialist like a urogynecologist, get some workup done. And there are many, many good treatment options for the treatment of prolapse. And the first step always is—
Dr. Siddiqui, you know what? I just realized we jumped into the talking about Kegel exercises. I don't think we really defined for our viewers. It may be self-explanatory in the name, but what is pelvic organ prolapse?
Right.
I don't think we even described that.
Yes, Aalia, you are right on keeping me on track. You're absolutely right. And prolapse is a mouthful, pelvic organ prolapse. But simply put, what it means is when the female organs start coming down. So the commonest complaint that women come and say is that they felt like a ball down there, a little bulge, or when they're washing up, they feel something down there. Sometimes it may be associated with they feel that they're not emptying their bladder well, or sometimes they may come in complaining of frequent bladder infections or urinary tract infections, because this prolapse has prevented them from emptying their bladder well. So it may be many different symptoms for many different patients, or for some people, it may be they are having constipation. They're all of a sudden feeling that they're not evacuating the way they used to be. So it could be a variety of symptoms, from as simple as chronic backache and pain and pressure to a ball or something like really you can see something and feel something down there.
Exactly. Thank you for that. It's for some people that, just hearing the words pelvic organ prolapse may be self-explanatory if you understand what each of those words mean, but prolapse is not a word we use commonly in conversation. Right. So I wanted to make sure we went through what that meant. And so, as we mentioned, a lot of the times that is caused by a change in the anatomy in our urogenital area. And so back to what we were saying about how can we fix this, or what are the options. So we mentioned the Kegel exercises to help to support that pelvic floor. And then you were about to mention some other things, which may be surgical possibly. And what does that look like? Because when people hear that word, automatically it's like, well, I don't want anybody cutting up inside of me. So I know that there are office procedures even before we get to that step. Maybe we can talk about that next.
Yes. And so, Aalia, what I did want to explain to people is that many different organs can come out. For some women, it may be her bladder coming out. For someone else, it could be her uterus or vagina coming out. And for some women, it may be a combination of all these different organs coming out. The first thing I want to reassure you is you guide the treatment. So please never hesitate to see a doctor thinking, oh my God, they're going to offer surgery. I promise you, I have been doing this for long enough. My goal is to educate the patients. We are a team. I give the options and you are the boss. You get to decide what you want to do. So please don't hesitate in going and seeing a doctor because you're scared of surgery. Remember, surgery is always the last resort when everything else fails. We never ever start with a surgical option. So as Aalia was talking about, we start with exercises. We do the pelvic floor therapy. There is a little device called a pessary, which for a lot of people, if they have heard of a diaphragm, most of my patients have heard of a diaphragm. So it is something like that. It's put in the vagina and it provides supports to the pelvic organs. And you can have a pretty significant improvement with that. So pessaries, I'm sorry, maybe I'll bring a picture next time. Pessaries are a very helpful support to any of the fallen organs. 90% of the times I teach my patients how to take care of it. It is really not a big deal. You can take care of that and you can have significant improvement. For a lot of patients, they do come in and they want it fixed. And surgery can be done for those patients. And the best thing I want to reassure you guys that surgeries can be done vaginally, which means there is no cut at all. So a lot of times patients are very surprised and saying, how can you do that? Like I had my surgery done and there is no cut anywhere. So that's the beauty of this kind of surgery, in which there is not even a teeny tiny laparoscopic incision on your belly. The surgery is done completely through the vagina. And the beauty of vaginal surgery is that there is very minimal pain because you have no cuts externally. Your recovery is a lot faster and better. And the incision, because there is no really external incision, your infection rate is less. Now, do remember, every patient needs to see an expert, figure out what is going on with them, and find out what's the best treatment plan. But there are many, many different ways of doing surgeries: laparoscopic, robotic, vaginal, and if need be, an open abdominal. So just because somebody else had a certain way or things didn't work for somebody, please don't hesitate in seeking help because you may be very different, your prolapse may be very different, and your treatment options may be very different.
Absolutely. Thank you so much for actually going through all of those different steps and the different options, because it's kind of like different tiers of like you said, where the patient is the boss. And that's the kind of collaborative relationship that I like to have with my patients as well. I'm here because I have the expert knowledge in the matter, but you are the boss. And so here are your options, and we'll have a discussion about the pros and cons of each to see what's going to best suit your needs in your life. Because at the end of the day, it's the quality of life for the individual that is affected. And so they definitely should be a big part of that. I want us to keep talking about this. We do have to take a short break first, Dr. Siddiqui, so we'll take a quick little break here and then we'll be back. You're watching What's Up, Doc, and we'll be back after this short break.
A free 3-minute online chat can give you the personalized tips you need to start boosting your retirement savings today.
When times get dark, we can't see the help that's all around us. Let 211 be your guiding light for help with food, healthcare, and other resources.
211, how can I help you?
Call 211 or visit 211.org. 211. Get connected, get help.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3.
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
We are Justice for All. Headquartered in the heart of downtown Chicago, Justice for All is a global humanitarian initiative dedicated to raising awareness for human rights concerns impacting vulnerable minority groups. Our diverse team of staff and volunteers, led by Imam Malik Mujahid, work tirelessly to help Justice for All achieve their goals. We promote policies that protect religious freedom, address the root causes of mass displacement, and recognize the plight of refugees and forced migrants. Together, we can continue to stand up for justice. Justice for all.
I am what hunger looks like in America. I am an 8-year-old girl who's not excited for the last day of school. Because this may be the last time I'll have lunch.
Till September.
I am a single father of 2 who works 3 part-time jobs, and that's still not enough to put food on the table. I was created by artificial intelligence from faces of the 1 in 8 Americans who struggle with hunger.
Feeding America, 200 food banks strong.
There are 16 million children struggling with hunger in America. That's 1 in 5 daughters, sons, neighbors, and classmates who don't know where their next meal is coming from. Yet billions of pounds of good food go to waste every year. It's time we do something about it. Feeding America is a nationwide network of food banks that helps provide meals to millions of kids and families in need. Visit feedingamerica.org to help them feed even more. Together, we can solve hunger. Together, we're feeding America.
Assalamu alaikum and welcome back to What's Up, Doc. I'm your host, Dr. Al-Barwani, and today we are joined by Dr. Gazala Siddiqui, and we've been talking about urinary incontinence and different causes for that. Right before the break, Dr. Siddiqui, we've been talking about pelvic organ prolapse, which is another taboo topic, as you said. I love the way you phrased that, as a cause for urinary incontinence. And we had finished discussing the treatments, different treatment options, for that. Now, as we mentioned in the beginning and throughout the show, there are different reasons for urinary incontinence. So when a woman comes in with the symptoms of incontinence, walk us through what you would do in your clinical practice to diagnose the cause, because as you mentioned before, the treatment is going to vary on the patient and the reason. So walk us through what you would do to make a diagnosis for the cause, and then we'll jump into treatment.
So Aalia, the interesting thing is for a big number of patients, a good clinical history is sufficient enough to start with. Like, we really don't jump into test immediately. We talk to the patients, and more so for patients with overactive bladder, it's pretty straightforward. Like, if they are waking up a lot, if they're going a lot during the day and leaking with urgency, we can start them on treatment pretty much on the same visit. And overactive bladder can be treated with medications. And I do want to let you know that that is the one field where we have seen a lot of innovation, and we have seen a lot of really good medicines with amazing results. So medicines were around, but some of them had a lot of side effects. But in the last 3 to 5 years, we have had newer group of medicines where the efficacy is really good with minimal side effects. So for that patient, that is straightforward. We can start them on the medicines the same day, and it's amazing how much change you can see within just a few days of starting the medicines. For our patients who are more complex or the picture is unclear, we give them something that's called a bladder diary, which is just a 24-hour record of how you're drinking, how much you're drinking, and we give a little measuring hat that fits into the toilet, and you actually measure just for a few times how much you're going and when do you leak in relation to your voiding patterns. And for another 40% of patients, that is enough, and we get enough information with that. For the remaining 10 to 20% of patients, we may do a special test called a urodynamic study. And that is, again, a simple test done in the office. It's not painful. And it's a very comprehensive test that tells us everything about their bladder capacity. Are they emptying their bladder well? Are they retaining urine? And are their muscles working the way they should be working? So it's an office procedure. And this is pretty much all that's needed for the workup of incontinence.
I love it. And that's actually one of my favorite things about certain diagnoses, when you can get a really good idea of what's happening just by asking the patient questions. As you mentioned, it helps to prevent delay of treatment.
Yep.
If we can diagnose right then and there, we're able to get the patient feeling more comfortable and with a higher quality of life in a shorter period of time than having to run through the hoops of imaging and then insurance coverage, etc. So I love that. So with that being said, let's talk about what are the options. As you mentioned, treatment options have come a long way, and they are going to be different for the stress incontinence versus urge or overactive bladder. So let's talk about what are the different classes in general of medication that are available.
Yeah. So overactive bladder, it is very interesting. Like, every patient has heard about some medicines. So that I do have to say, those ads are very catchy, as you were mentioning, Aalia. So, gotta go. Almost every woman has heard about that. So there are many, many different medicines. We always start with the basics, kind of limit your intake to 64 ounces. So there's a lot of myth out there. I've heard people drinking like gallons of liquid. If you're young and you're an athlete, that is good. But past the age of 50, there's no benefit of drinking too much liquids, more so if you have a bladder problem. You should not be on diuretics if it's just for high blood pressure. So kind of talk to your primary care doctor and see, do I really need a diuretic? If you're waking up a lot at night, cut down your liquids in the evening. Don't drink your caffeine late at night. And then time your voids, like more so for my elderly patients who have difficulty walking and moving, kind of planning a bathroom break every 3 hours, 2.5 hours is helpful so that you don't get into a phase where you're having accidents. Once we have a diabetic, very important to control your diabetes, because when your sugars are not controlled, you're very thirsty, you drink a lot, and you also do not have the sensation that you have to go. So that is very, very important to control that aspect of it. And after that, there are two main class of medicines that I want to mention without going too much into details. One is called anticholinergics, and those are medicines we give them relatively to our younger patients and they work very well. They may have a little bit of dry mouth, but majority of patients tolerate very well, and we have excellent results. For our older patients, because of some of the side effects, we give them medicines called, these are called beta agonists, and they work very well, and they have very, very minimal side effects. And there are a lot of new beta agonists. One came out just like within the last 3 to 6 months. So again, the key take home is talk to somebody, try something. A lot of patients will say, oh my God, but when my aunt took it 15 years back, she had such bad side effects. I really want to tell you guys, this is the field where changes have happened a lot in the last few years, and unless you talk and reapproach a doctor, you may miss out on some really good treatment options. I know you may have heard of Botox in the bladder. So if medicines don't work, the same Botox that you're using for your everywhere else in the body, from migraine to your wrinkles, works beautifully in the bladder. And then there is something called InterStim, which is like a little pacemaker for your bladder. And of course, it's reserved for your really serious patients. But what I do want to bring out is that, like, there is no one perfect treatment option that fits everybody. And we have a lot of treatment options. So there is something out there that's going to make your life better.
I love it. Thank you so much. When you said Botox, I was going to bring that up, but I'm glad you did as well. And then there are also fillers. I don't know if you call them that, but the collagen.
Yes, absolutely.
Yeah. So again,
yes,
it can go anywhere from your face to your.
Yes, absolutely.
Your
Yeah, bulking agents. Again, we use it often. So.
Exactly. And I know that there are also, I've read about some investigational, I don't know how, if you're using this, but like stem cells as well. I thought that
stem cell is, unfortunately, it's not the mainstream yet, but it's on the horizon. So it's always hopeful to see what's not working today will get better tomorrow. So
exactly.
That's the biggest message I want to give to all women out there is that there is hope. There are a lot of treatment options. Taking that first step is very critical. And I honestly, as you summed it up, I really believe patient autonomy. Yes. Just because you're going does not mean you're committing to anything, but not even talking to somebody, you're kind of depriving yourself from checking out what's out there. At least go check out, see what's available, and then decide if you like it or not.
I completely agree with you, which brings me to another point that I wanted to also throw in here before we end our episode. And there's this misunderstanding that medications for certain conditions, which only help to manage symptoms, are treatment and cure. And what I mean by that is, while these medications can help to alleviate the symptoms of whether it's stress, meaning when you're coughing, not having that leakage, as opposed to the overactive bladder, once you stop taking those medications, your symptoms will return. The medications help while you're taking them for the symptoms. And I bring that up because I have I've had a number of patients who have high blood pressure, and completely different but similar mindset, where I finished my 30-day prescription for my blood pressure. So I thought I was done. And I have to explain, when it's not like an antibiotic, this is an underlying condition. Yes. And so similarly, just in educating for the purpose of our audience, really understanding that these medications, we have medications that are cure-alls, and we have some that are really just managing symptoms. And that's what we are talking about when we talk about medications for this.
No, Aalia, thank you for bringing it up, because that is a very, very important point. Because I tell my patients, OAB is a medical condition. So, just like you are used to taking medicine for high blood pressure and diabetes, you will need to take medicines long-term. But if you look at it the other way, one pill a day, if it's giving you back your sanity, your hygiene, and your morale, why not? It is honestly, these are 24-hour medicines. You never have to take it 3 times a day. And absolutely right, it is not an antibiotic that's going to take the infection away. But at the same time, if you take one pill in the morning and that gives you the flexibility of control and avoids public accidents, why not? And then if you're one of those people who absolutely cannot take a pill, or the medicine didn't work for you, then you discuss your doctor and go about and talk about Botox, which can last anywhere from 6 to 9 months, or the implant, which lasts for 5 to 8 years in time. So again, there are options. We just need to find that one option that fits your lifestyle best.
Absolutely. And when it comes to dosing, do you find that you have to increase dosing for patients over time as they adjust to a certain dose, or are patients able to stay on the same dose for years and years and years? And I know it's going to vary from person to person before you even answer that, but I guess in general, what are you seeing more of?
Yeah. So I'll tell you, it more than patient needing a higher dose, what happens is you have incontinence, you start becoming very careful about what you drink. You take a medicine, you start getting very good results, and you get lax, and your 2 cups of coffee changes to 4 cups. And so more than your body getting used to the medicine, it's you getting used to the benefits of the medicine becoming very lax. So that may lead for you to need a higher dose. But in general, we have good results, and I don't feel that medicine stop working over a period of time. But just think about it. Just like, a diabetic, sometimes they will eat a carb. And I tell my patients, okay, so no big deal. One day you had 3 cups of coffee, but overall, try and stick to a healthier routine. Watch what you drink, at least watch your caffeine, and you will have a much better result and do better in the long run.
I love that. And that is a really, really good point. I like that. People get used to the benefits of the medication and then they start to relax. That's a very good point. And with that last point, Dr. Siddiqui, I just want to thank you again for joining us on our show today. We've talked about a really important topic today, and I hope that I'm sure that we've shared a lot of gems for our audience. So thank you again.
Yeah. Thank you, Aalia. This was so much fun talking. And I am here because I am very passionate about both these topics. And even though I've been in practice for a while now, nothing makes me sadder when I still see a new patient who comes to me and says, I have been suffering with this for 5 years and 10 years. And that really breaks my heart. So to all the listeners and viewers out there, if nothing, please take a chance and go talk to somebody and at least discuss what options are out there, and you will not regret that. Thank you again, Aalia.
I agree. Thank you again. And thank you all for joining us on another episode of What's Up, Doc. There are other episodes on our website at muslimnetwork.tv. I'm your host, Dr. Aalia Al-Barwani, and I'll see you next time on another episode of What's Up, Doc.